This is Colin O'Keefe here with Friday's episode of LXBN TV. As Medicare and the spending it receives garners a great deal of attention, Medicaid sees startlingly little coverage. Joining me to offer his thoughts on why that might be is Dennis Smith, Managing Director in McKenna and Aldridge's Washington, D.C. office and author on their Politics, Law, and Policy blog. Dennis, first, why do you think Medicaid is talked about so little, especially in comparison to Medicare?
Well, Medicaid is really run by the states, so overall the decisions are made at the state level on provider reimbursements, managed care rates, the things that Washington does here for Medicare are then replicated throughout the country, but all of those decisions are really made in the state capitals. Second, I think it also is reflective that in many respects, the Medicaid population and the Medicare population are very different. In Medicare, of course, overwhelmingly senior citizens are on Medicare, but also individuals with disabilities. In Medicaid, the majority of the population are children. So while seniors are a very active voting constituency, in the Medicaid population is quite different. Also, the way that Medicaid works is federal dollars follow state dollars. The state first has to decide to spend that dollar, where to spend it, and then the federal dollars follow. But ultimately, that is a state decision first and foremost, and those decisions are made in 51 capitals instead of here in Washington.
Absolutely. And second, as you wrote on, the CMS just recently released the 2012 actuarial report on the financial outlook of Medicaid. What was the biggest message we can take from this?
I think the most important message is that Medicaid is in very much need of reform. In the state level, at the federal level, expenditures are growing faster than revenues. When we have that situation, Medicaid then is either going to crowd out other priorities, and you see that at the state level in particular. We have to take money away from education. We have to take money away from investment in public infrastructure. We have to take money away from public safety in order to fund the Medicaid program. The program itself fundamentally does great things, does things that Medicare does not do, does things that the private sector does not do. So it's a very vital program, but it is very much in need of reform because the trajectory we are on is simply unsustainable.
Absolutely. As you mentioned, Medicaid is a vitally important program that helps a lot of people, especially children, so it'll be interesting to see if this does receive the reform and the attention that it needs in the near future. Again, that was Dennis Smith of McKenna and Aldridge. For more of his insight, be sure to visit politicsandlawblog.com. And of course, visit us at LXBN.com for more LXBN TV video interviews. And of course, we also have curated commentary from the LexBlog Network's more than 8,000 lawyers. Thanks for joining us today, Dennis.
Thank you.